Sometimes, danger hides in plain sight. An ordinary meal, a birthday party, a child's laughter. And then, in a heartbeat, everything changes. Anaphylaxis doesn't wait for awareness. It exposes the blind spots that can cost a life.
My daughter Natasha, we discovered she had food allergies from when she was very, very young. When she was 6 months old, we were on holiday and I gave her a tiny bit of banana. I literally just smeared it on her lip and she didn't like it and she was trying to sort of spit it out with her tongue. And within 5 minutes, her face had swelled, her mouth had swelled, she was bright red all over and she had an anaphylactic reaction.
Well, anaphylaxis in simple terms is explained as the most dramatic, the biggest and the most terrifying allergic reaction you can experience. It can start in a few moments and it can go to a level that is enough to kill a person.
For 9 years, she hadn't had an anaphylactic reaction. She was managing it well, and we were generally as a family. But on the day she died, she had eaten a baguette sandwich that contained sesame seeds, and they weren't visible to the naked eye, and they weren't mentioned on the food label. She was boarding a plane, and when the reaction started, she just really needed medical help that just wasn't available to her. And even though she was injected with adrenaline, it made no difference, and she passed away later that day in a hospital in Nice.
I think I should define that with a severe reaction, immediate reaction, after a trigger. With more words, it is a reaction that happened to a patient when he take food, a drug, when they have an hymenoptera, a sting, and immediately the patient starts to have some symptoms.
The reactions involve urticaria on the skin, that means wheals on the skin, and reddening and pruritus. It also involves nausea and abdominal pain and circulatory problems or respiratory problems with dyspnea. It becomes difficult if you don't know exactly the trigger. The trigger normally is of a drug, of a food or an insect venom. And if you don't know the trigger, you have got a lot of work to do.
So I was on holiday in Italy with my friends. We were out in the evening, had dinner, and then after dinner, where I was eating obviously gluten, walked to a bar, and there, when we arrived there, I started feeling the symptoms, which I didn't know what it was at the time. And then I lost my eyesight. I couldn't see anything. And I couldn't hear anything.
¿Cuáles fueron los síntomas? Pues uno de los síntomas que tuve como diarrea, malestar en el estómago, me empezó a picar un poco las axilas, la palma de las manos, y yo comprendí que mi cuerpo ya me había cambiado.
When the unknown becomes known, fear turns into knowledge and knowledge into survival. Each story begins in darkness, but it's only by seeing the blind spots that we find the spark of light. For centuries, the mystery of sudden allergic reactions has challenged doctors, patients, and science itself. What begins as a simple rash can become a race against time. To understand anaphylaxis is to confront how fragile and extraordinary the human body truly is.
Anaphylaxis actually was researched by Portier and Richer, and they received the Nobel Prize for it in 1913. It was at the time when it was thought that the immune system was only positive for the body. And they did their research, interestingly, on the yacht, the personal boat of the Duke of Monaco, on the immune system fighting toxins from jellyfish. And they were using dogs, and they were first training the immune system with very few minute amounts of the allergen, and then increasing the dosages, thinking they would get protection. But they saw that the animals reacted differently. They had a severe anaphylactic shock. And this they described. And they termed it anaphylaxis. This comes from the Greek, and it says ana, which is the opposite, against. Phylaxis is protection. So anaphylaxis means against protection.
During anaphylaxis, the main mechanism depends on the vessels. The vessels get widened and there's the leakage of fluid from the vessels. So the main drug should be adrenaline, which is known as a drug to tighten the vessels.
The sooner the adrenaline is administered, the best result for the patient. We cannot wait and try to decide whether this is an anaphylaxis, whether not. Let's wait, because the sooner it is administered, the better. The health system needs to understand that anaphylaxis can happen at any age, that it is can be a quite severe reaction, that the patient can die, and that they need to give the tools for diagnosis and for treatment, and that the auto-injector needs to be available worldwide, probably in the future, then intranasal adrenaline.
One of the challenges we face with how we understand anaphylaxis is that we really do not understand the immune pathophysiological mechanisms of anaphylaxis, because this will make it much easier for us to develop novel therapeutics, prevent the onset of severe reaction that one we see in our patients. Well, research is fundamental to support patient management, because the research we do is then translated from what our physician colleagues are able to see patients and really then treat them. But what's really important is how we get there, and what we need is have substantial funding work which can support all the research that we do, immunological research, translational research, but also something that really helps move from bench to bedside, because what we need to do is we need to start at the bench, we need to do some very fundamental studies, and then we move into patients, and where we can really focus on curing or managing our patients better with better treatments, apart from just having adrenaline that we have currently today.
Of course, we need more research, because we know that adrenaline is effective in approximately 5 minutes, but we need a drug that can act faster. Also, we need research on the mechanism of anaphylaxis so that we can prevent the attacks and the patients can be free of anaphylaxis attacks, because we know that in some patients anaphylaxis can occur without an exposure, and we call it idiopathic, which means the attacks can occur spontaneously.
As a medical doctor, many times parents who have their children that never experience an anaphylactic reaction, they ask me, should I carry an adrenaline with me because I never had a reaction, but I may have in the future. And they are right, there is a risk factor. Although we are always focused on reassuring and promoting health and giving confidence, so we don't want people to be overstressed with disease, we need to find better risk factors for the ones that we will experience in an episode.
I think I would like to change that. I should have taken it more seriously when I had my first attacks or triggers. Instead of being the naive person I was, I should have gone to the doctor sooner to start the investigation.
Knowledge doesn't end the fear, but it teaches us its language. The more we uncover, the more we realize how much still lies beyond explanation, waiting for us to listen, to study, to care. Imagine living every day with eyes wide open, scanning every label, every bite, every breath, every act. For those at risk of anaphylaxis, vigilance is not paranoia, it's survival. This is life on constant alert, where awareness becomes both shield and burden.
We were on holiday. We were here in Stockholm in a restaurant, and I remember I'm always trying to talk to the chef who's making the food to shorten the chain so there will be no mistakes. And I was explaining all the allergies, and he said, "Oh, no problem, no problem." And due to this, I trusted him, because the way he described how he was going to prepare the food, I felt safe. So the food came in, and I asked again, "Is everything?" He said, yeah, don't worry." And my son had 2 bites of the meatball, and I immediately saw that something changed He has stood up, very disorientated, and ran to the bathroom. And we had like a medicine bag with us, but at that time we didn't have any adrenaline. So I ran after him into the bathroom, and he didn't know if he was going to throw up or he was just feeling very, very confused. And I also knew then back in my head that our doctor has said when he's having a reaction, try to be calm. Otherwise he will be stressed and that can then increase the reaction. So I thought, okay, I have to be calm. He needs to go to hospital. So we gave all the medication that we had at that point. Then we put him in his little sister's trolley and ran to the boat because we are on an island. And of course I know I did everything wrong. I should have called the ambulance, but in my mind I thought I was doing the right thing. And I think someone was watching over us that day, because when we were on the boat, I called my father, who met us at the boat, and he drove quickly to hospital. But in the end of the trip to the hospital, I had to shake my son because his eyes had started to roll, and I was really, really terrified what would happen.
So it is, especially with kids, it's extremely important that the kids need to understand. Then the parents and many people and the family need to be ready for administering the adrenaline and to identify the food. Usually they also need to understand how, because it's affects the family life. They need to, because if they are cooking, they need to prepare the food. For example, here in Spain, that during Christmas, all the family sit together, and we all, if it is cold, everything is closed, and we eat shrimps. They need to understand that even with the cooking of the shrimps, is enough for patients to develop reactions. So everybody needs to understand, because if not, sometimes the answer is, there is no problem, it's only a small piece. Grandparents are extremely important because they need to understand that it is a severe reaction. So everybody in the family needs to be involved and ready to act and ready to prevent the possible reactions.
I usually see adults but also children with anaphylaxis, and I know that it is very important, this awareness campaign of anaphylaxis, because especially for children and adolescents, it's very important that they know the importance to have with them, always with them, the adrenaline, and it's very important also to know how to use it.
People in the emergency unit, general physicians, at the school, nurses, everybody needs to be trained first to identify an anaphylaxis, and second, how to treat, how to do the immediate treatment that will save life.
Patients at risk of anaphylaxis face daily challenges that go often under-noticed by others, such as managing certain symptoms and adapting their lives to the dietary, environmental and social restrictions that the condition requires. That's why increasing awareness on this is vital for our community. We need the support of clinicians and all the stakeholders. We need more collaboration to keep our patients safe.
The number of food allergic people have been increasing. We thought we were very rare, actually, with our lives with Natasha. And I think that was really the very first fire, really, that was ignited to really try and help others so they would never experience what we had been through as a family.
Even when fear never sleeps, strength finds its rhythm. In every choice, every precaution, and every act of courage, there lies the quiet heroism of those who live with eyes wide open. Courage doesn't always roar. Sometimes it is quiet and mindful. In a world that celebrates spontaneity, patients living with anaphylaxis learn to challenge assumptions, to speak up before each act, each turning decision. Because safety is not achieved alone, it thrives in awareness, support, and the vigilance of a caring community.
I do feel like the annoying person sometimes that's like, I can't eat here, I can't eat that, we can't do that, you know. So that I think is my biggest struggle.
Many years ago there was not many things offered, and then I found out that Vigilance has a specific buns and cakes for people with allergies.
Usually when it comes to allergics, if you have a group of 10 people, usually at least one is allergic to something. So if I can provide that too, it's good.
So Natasha's law has had dramatic impact in the UK around food labelling laws. I mean, that's what it is. It was a game changer that essentially fixed a very big hole that was present in the food labelling laws of the UK. So it's been a very, very positive effect for just about everyone.
So when it's come to starting a new production that is 100% safe, it's difficult, but it's possible. You can do it, but you have to have staff that's educated. You have to be really interested yourself, of course, because if you don't interest yourself, you can't make it.
So one of the things we really see generally in society and in food establishments is a lot of people, still don't really understand food anaphylaxis, and they confuse it. They confuse it with things like intolerance. And I think anyone listening will know that intolerance is this way and food allergy is this way. They are completely different and not the same at all. Only food allergy really is something that can be very serious in terms of life-threatening or put you into hospital.
From the beginning, this was actually a business decision because we saw this as an opportunity because there weren't that many places that provided this kind of, because they didn't know how to make it, they didn't know who would buy them, because usually it's a lot of tradition in this trade. It's a lot of, you have to have this and this and this inside. If it's not this and this and this inside, you can't call it this. But you can. It's just a different version of it. So in the end, I mean, it's for the people. I mean, I wouldn't say fika here in Sweden is the most, I would say the most profound and this is a right to have a fika. Once a day you should have a coffee and a bun. And if you can't have that, then it's not worth living, I would say. Fika is the best. And if you're allergic, now you can have a fika because we can provide everything for everyone, pretty much.
Wisdom is not silent. Every voice nurtures awareness, reminds us to watch, to care, and to protect one another. From fear to empowerment, from isolation to community, awareness sparks action. Every life is touched by caregivers, clinicians, and policymakers, each leaving their mark. Together, we can make anaphylaxis not just a medical term, but a call to stand for every life we are responsible for.
This campaign is so important because it's going to hopefully trigger in people's mind an awareness of what anaphylaxis is. Anaphylaxis means without protection, and the body can't defend itself unless it gets the life-saving medication of adrenaline. So it really matters that people know what to look for and what to do.
I think that the anaphylaxis campaign is important because anaphylaxis is something that is impacting a lot the quality of life.
So the Swedish allergy program we've been lobbying for almost 30 years now. So advocating takes time. This is also important. It doesn't happen overnight. But now finally, and this will be a guidance for all the regions. What is needed? What do they need to do? So people will get equal care. It doesn't matter where in Sweden they live. Having this program, like in Finland, is crucial for people to get better and equal care. Right treatment, right diagnosis, and to live a better life also.
La journée mondiale de l'anaphylaxie est vraiment très importante parce qu'en fait l'anaphylaxie, on le sait, peut provoquer le décès en quelques minutes et malheureusement l'allergie est très peu prise au sérieux et donc cette journée permet d'informer et de sensibiliser aussi bien le grand public que même les professionnels de santé. Pour nous, donc, c'est vraiment essentiel que cette journée ait lieu.
The Anaphylaxis Awareness campaign is so important because it needs to raise awareness and people will learn how to recognize and act correctly in case of anaphylaxis.
The anaphylaxis campaign is important because it's the way we have now to show people why anaphylaxis is so important, why there's so many people having anaphylaxis.
EAACI can trigger all the stakeholders to take action against anaphylaxis.
The Anaphylaxis Awareness Day that's been created by EAACI is a great idea. It's fundamentally a great way of everybody focusing on an issue that we all have in common across many, many countries. And EAACI is a great organisation that can really help bring focus, skills and lots of people, not just clinicians. It's really, really important that there are people who have the patient voice. Clinicians who work on their own or researchers on their own, that's fantastic, but they can often miss the real issue, which needs to be heard really from the voice of the patients, the people who have the lived experience at the end of the day. And you bring the two together, it's much more powerful.
I think that we have brought together, but together means discussing together, patients, family of patients, researchers, basic scientists, clinicians, nurses, absolutely all the people that have something to say about the management of anaphylaxis.
With close collaboration with our patients as being partner of EAACI to really create enough awareness, ensure that we are able to lobby for more understanding of where we should be focusing in terms of unmet needs. We have the experts who are members of EAACI, we have the key opinion leaders who we are going to leverage and bring them all together to really focus on this important topic.
We should not tolerate any deaths. It's the same with anaphylaxis. We should not tolerate any deaths of a child, of a patient, either in a school, either in a hospital setting because of medication, even with venoms. So, vision zero towards anaphylaxis.
When fear meets courage, something shifts. A breath steadies, a hand reaches, a mind awakens. Lives are changed not in silence, but in the echo of action. In the end, it's not the trigger that defines us, but how we respond.